My Lords, here we are, rather surreally, at a debate about a set of regulations that were passed so many weeks ago that now we've arrived to debate them as they're being abolished, which rather makes a mockery of the idea of scrutiny before we start. And I haven't really liked, whilst I've been in the House, this idea of nodding through or what's felt like rubber stamping so many important decisions. As I was listening to the abolition of Plan B in the other place, I reflected that it sometimes feels as though our freedoms are treated as gifts from those on high, to be withdrawn from the public far too easily based on the precautionary principle. Keep on being cautious, we're even told now, and then given back to them as though an act of generosity. But nonetheless, I don't want to be churlish. The announcement that Plan B is consigned to the dustbin of history is great news, and hurrah. Perhaps then this discussion is all a bit of a going through the motions, and what we should be doing is having a celebration with wine and cheese, or just celebrating the end of an awful policy of demanding that I particularly don't like that demand that people show their vaccine certificates and reveal their private medical information in order to access or engage in public life. However, I don't think there's room for complacency. If I want to ask the Minister if vaccine passes that he says weren't vaccine passes might have set up a dangerous template that I still think is in existence, and that is that equal treatment for all citizens is jeopardised by certain access to particularly jobs contingent on medical status, and that has not changed with the abolition of Plan B. Isn't this a coercive and discriminatory new normal that divides society into the vaccinated and unvaccinated? Look at the way that employers such as Morrisons and IKEA are depriving unvaccinated staff of sick leave. And they're taking a lead from the government policy that gives the vaccinated privileged access to jobs. I'm referring, of course, to the government's continued retention of VCOD1 and VCOD2. That is the demand that care workers and NHS staff have to be vaccinated to keep their jobs. In the other place, earlier today, MPs across parties noted that getting rid of Plan B is incomplete in spirit at least, when at least 70,000 NHS staff could be sacked from April the 1st, and NHS trusts in England are, as we speak, preparing to send out dismissal letters from the 3rd of February. I agree with the Royal College of Nursing CEO, Patricia Marquis, and I'd like to know whether the Minister does, that the government need to instigate a major rethink here. Quote, mandating is not the answer, and sacking valued nursing staff during a workforce crisis is reckless. Reckless is a very strong word, my Lords. Yet despite that, the Prime Minister's response was to mutter about following the evidence. But we know from the evidence that while having vaccines and boosters may well be invaluable for protecting individuals from serious illness, and I'm a great supporter of that, the evidence just isn't there on lessening transmissibility. So can the Minister comment on the latest ONS estimates on the likelihood of testing positive by vaccination and reinfection status that showed that there's no significant reduction in the likelihood of testing positive after 2 vaccinations? And also, has the Minister any views on the leaked memo from his own department that makes clear that, privately at least, in the department there are those who are saying this anti-worker mandate is irrational and disproportionate? Beyond pragmatism about unnecessarily losing vital health and social care staff in the face of weak evidence, the constant official line that such policies are necessary to protect the vulnerable patients and care home residents, I think fuels a climate where the unvaccinated are being accused of being selfish and dangerous. And I think that that's a very dangerous, divisive message when you think that that's aimed at the care workers who worked their guts out for months looking after the elderly, but have decided for whatever personal reason they don't want a vaccination and are now dumped. I think it sets up a terrible template for society, driving citizens into the dividing citizens into the safe and unsafe categories, the unvaccinated demonised as unclean, disease carriers and so on. And this divisive and misanthropic message can only undermine social cohesion. And I think that narrative has actually come from the very regulation we're discussing of vaccine accreditation, and can at times, I think, really cause us real problems, going into the future. So I'd say good riddance to vaccine passports. I'm loath to pat the government on the back too much for rescinding the policy, because I don't think it should have ever been brought into law. But I do want to credit grassroots campaigners such as the tireless Together Coalition, who have kept up extra parliamentary pressure. And the worst thing about that, which should be an inspiring example of civil society, is that for their trouble they've been dubbed anti-vaxxers, a term now promiscuously thrown about to close down debate too often on vaccine-related policies and to discredit individuals and campaigns rather than engage in open-ended arguments. Now, I want to finish on this because I think that Plan B's gone, good, but there's still a lot of animosity, tension in society around vaccines that I just want to finish on. Of course, we all know that there's a small fringe group of nihilistic views that are preoccupied with conspiratorial theories about Bill Gates and Big Pharma. I think society can live with that small group existing. But I worry that the positive case for the vaccine is, which I consider to be a fantastic medical intervention, a great tribute to human ingenuity. I worry about that positive case being jeopardised if we lose all nuance and lump all views together. I was shocked when the opposition, arguing for a ban on protest gatherings outside schools, it's part of the police and crime bill, labelled people gathering outside schools on vaccines as anti-vaxxers. But actually, I know parents who've organised some of those events, and they were concerned about young children being pressurised into having vaccines, even though themselves they were vaccinated. And also, they were quoting the JCVI. How can we call them anti-vaxxers? I worry that young people who are healthy, full of antibodies, have had COVID, maybe have had one vaccine or two, but don't want the booster, for whatever reasons, are then called anti-vaxxers. I worry about pregnant women who are nervous about the vaccine being called anti-vaxxers. I worry about the disproportionate number of ethnic minorities who, for all sorts of reasons, seem reluctant to have the vaccine to be lumped in with anti-vaxxers. Or the NHS 100k campaign that comprises of health workers, doctors, nurses, midwives, anaesthetists, across the board, all who oppose the mandating of vaccines, and they have been labelled anti-vaxxers. But to note, many are fully vaccinated but believe in the medical ethics of bodily autonomy and choice. So I just want to ask the Minister to go back to the department and say that while this issue of differential treatment of the vaccinated and the unvaccinated, as institutionalised in the vaccine certification regulations we're discussing, while that's been abolished, I think this problem of treating the unvaccinated as lesser citizens is very dangerous, and I won't be celebrating freedom being restored until that has been abolished as well.